Everyone. All right, welcome to our Public Health and Safety meeting on May 7th, 2024. We have President Councilmember Benton, Councilmember Bradford, Councilmember Huffman, Councilmember Kimbrough, Councilmember Nash, Councilmember Taylor, myself, and Councilmember Weiner is here. She's here. So we still have a quorum. Thank you. All right. So we're going to go through the business. It's number one on our agenda, but we're going to go ahead and go through the business of the calendar first, and then we'll have the Reach pilot. We'll have a presentation from a few folks to discuss that Reach pilot. And so, if there's anything that we need to discuss also after that, we can do so after the business of the agenda. All right. So we're going to start with number 2, RS 2024-392, Porterfield, Evans, and Taylor approves a contract by and between the Metropolitan Government and Rite of Passage Incorporated for operation of management services for the Davidson County Juvenile Detention Facility. Do I have a motion? It's been moved and properly seconded. Any discussion? Councilmember Prep-Teat, did I see your hand for discussion? Floor is yours, Councilmember.
All right, thank you, Mr. Vice Chair, and my apologies for my slight tardiness. On this, I just wanted to give Juvenile Court Administrator as well as Judge Callaway the opportunity to address this. I know that there are several questions around this specific contract. And so I'm going to tee it up for you here, Judge Callaway. Thank you so much for being here this evening. But could you give the committee an overview on where the juvenile court is currently with the administration of oversight and staffing at the juvenile facility?
Absolutely. Thank you. Okay, sorry. Thank you all for.
Thank you.
Sorry. Thank
Judge
you all
Callaway,
for allowing me
go
to be
ahead.
here.
The floor is yours.
As I don't know if all of you all know, but in 2020, we had a contract with another provider, YOA. YOA stepped out of that contract prior to it being over, and we had to issue, it wasn't 2020, I apologize. 2022, I apologize. And we had to issue an emergency contract. And so Rite of Passage was the the entity that got that contract. They came into it. We had an 18-month contract with them. Now we're going month to month until we can get a finalized contract. The Metro procurement process went through did an RFQ for other facilities or other people who would be interested in running the facility. Our Rite of Passage was the only one that answered the RFQ. I will say in last year, at the end of last year, there was an audit that was done by Metro government. And in that audit, there were some concerns, particularly about staffing issues and about reporting on incidences that happened within the facility based on what they're supposed to be reporting. We have worked with ROP to try and help the staffing issues and to make sure that they are on track for staffing, as well as we have been working with another agency called CJJA, which stands for Council of Juvenile Justice Administrators, and they're equivalent to the ACA for the adult facility. They work for juvenile facilities and trying to make sure that we're doing best practices, that we're getting the forms correct, that they can fill out, and make sure that we're getting everything that we're supposed to do. The staffing is still not exactly where we would love it to be. And one of those things is it's probably a little difficult operating under a month-to-month contract to convince people to come and work for them if there's some uncertainty of what's going to happen next. And it is a difficult field to work in. There are not a lot of people who are saying, ooh, I want to go work with these youth in our detention facility. But from where we were when YOA left the facility, we are a lot better than we are right now. I have Jennifer Wade here, who is the court administrator, along with our team. We also have two individuals from Rite of Passage with us as well. Bill Wood, who is the regional director, and then our director, Mr. Flores, are here as well, along with our contract monitor, Latana Williams, and our deputy administrative grants, Mr. Jim Swack. And so we're all available to answer any other questions that you may have.
Thank you, Judge Callaway. Mr. Prepty.
Thank you, Mr. Vice Chair. A question that just came to mind as far as staffing goes. I know that generally when it comes to our adult facilities, the sheriff's office is the one that staffs those correctional officers. Have there been any conversations about with Sheriff Hall about him sort of trying to supplement staffing needs with some correctional officers who potentially be trained to be able to deal with the specific needs of juvenile court?
So we have spoken with Sheriff Hall on a lot of occasions about a lot of different issues with running a detention facility as well. Sheriff Hall has told this body before that he's not interested per se of running our detention facility. He absolutely will help us if he needs to, and has willing that offer. There is a lot of different training it's a whole different ballpark from running a adult facility than it is from running a juvenile facility, which is why it's difficult. In the juvenile facility, there are so many more things that you have to do and so many more things that you cannot do. For instance, in an adult facility, if people are rowdy and having a gang fight, they can lock them down and put them in solitary confinement. That's not allowed in juvenile facilities. And so there would be a lot of training. And although Sheriff Hall has always been very open with me and willing to help in any way that he can, he would prefer not to have to.
I just have two more questions. And this one is specifically for the folks with ROP. So in reviewing this specific contract, or let me back up. So the mayor just released his proposed budget for Metro. And within that proposed budget, one of the things that he's including is a minimum wage of $20 an hour for Metro employees. So even though you'll be operating as a contractor under Metro, are there any, and it's not addressed within the language of the contract specifically, but are there any plans to, or any supplemental policies that you could point to as to what the pay would be and whether or not it would be comparable with what the mayor is proposing as far as a minimum wage?
And this is Mr. Bill Wood.
Yeah. In the new proposal we put through for the contract, the per diem is higher, and that is to fund higher paying positions. So our starting wage has moved up to $20.50. So we've done that, and we've added a number of staff members to improve our ability to meet the licensing regulations with the ratios.
Thank you. And then my last question is Judge Callaway or Magistrate Jennifer, sorry, not remember. Wade.
I call her Magistrate Wade all the
Magistrate
time.
Wade. Either one of you can answer this question for me. Could you speak to specifically the benefits of us being able to enact this contract and move away from essentially a month-to-month basis on this contract?
I think there are a number of benefits right now. For instance, as Mr. Wood just stated, the contract that they are asking for us, or that we have agreed upon, increases the per diem, which also increases the salary amount that they can give for their workers. And what that means, if you have an increased amount of money that you're paying the people, then perhaps we'll have a better quality of individuals that are going to apply. There's also room in the contract now for additional therapists to be in the facility as well. They've already interviewed they have one full-time therapist now and a part-time. They've interviewed a different therapist to come in as well, because that is a big need for our youth. As far as programmings with more stable money, they're able to bring in more programs. We do have some programs now that are funded, like through NASA has a program that they bring in, the group Why We Can't Wait, and that's a grant that they received. But with additional funds, and that might be open the door for ROP also to bring in additional programming as well. I don't know if Jennifer has anything, Ms. Wade has anything else she wants to add.
Just additionally and specifically hiring a therapist, a full-time therapist or two, to support the needs of our high trauma youth that we serve as well. So I would just say that additionally. Also, it allows us to move toward the new contract expectations officially, which we also included some liquidated damages in. And so we like to be able to operate under that contract so that we know exactly what the new expectations are. We're able to hold accountability to that. And then we have set recourse to that as well.
Thank you, Mr. Prepti. Any additional discussion? All right. So just to let you know who I have in the queue, I think I saw Councilmember Bradford, Councilmember Benton, and Councilmember Ellis. Is that correct? Oh, Councilmember Huffman. So Councilmember Huffman, I did see you earlier. So we'll go to Councilmember Huffman then, and so on. Okay.
Yep.
Councilmember Bradford.
Just simply, did we skip over public comment?
We did not have anyone that signed up for public comment. Thank you. Councilmember Huffman.
Thank you, Chair. Quick question for the account rep. I didn't catch his name for rite of passage. If he could make his way up and say his name into the mic, just for the record.
William Wood.
William Wood, thank you. Mr. Wood, question for you. Doing a little, anytime there's only a single applicant for something like this, especially as it involves our youth who are looking to be rehabilitated into upstanding citizens, always like to look at the track record of a particular entity. In doing some research into you guys, I noticed there was a report that came out of Arkansas. I don't know if that was your area of coverage or not. Just a few things that troubled me was in regards to staff keeping youth in concerning confinement for a long period of time. Other things involve lack of proper therapy regarding certain individuals' conditions. I didn't know if your company itself, I guess, learned anything from that incident that you plan on carrying forward with our situation here.
Yeah, absolutely. And I have recently been put in charge of helping out with Arkansas, so I know all the things that you talk about. I wasn't working with them at the time, but yeah, what we've learned, and it's interesting, it wasn't the practices as much as staffing is everything. And the difficulty in getting staffing, and some of those incidents happen in some of these very rural outreach programs. Arkansas is set up so that they have one facility in Little Rock and then some of them in pretty rural areas. And staffing those have been very difficult. And so one of the things that we've learned that we're actually doing here is we are working to pay a higher wage to staff members, so we get better staff members that are more capable, and we get enough people applying for the job, so then we have a staff that isn't that good, that we can move them very quickly. And so staffing is everything. The policies and procedures, you know, those are in place. But when you don't have the staff members, the adequate staff members, your systems break down. And that's what happened in Arkansas. And we're doing everything we can to make sure that doesn't happen here, you know, with our operations.
Great, thank you. Just one follow-up for you. If, let's just a hypothetical here. Let's say we move forward here tonight and you get this contract and you have an incident with one staff member, we'll say. What's the corrective action or the steps that are taken to ensure that that doesn't happen again? Or is that person still employed? And I'll let you answer. Yeah,
well, it varies. If it's, you know, it can be at any level. If it's any type of an abuse to a young person in the facility, then everybody is a mandated reporter, and that's reported to social service for investigation. We suspend those people, usually pending the investigation, but if we know there's a policy violation that's serious, we'll terminate their employment. And then there's other corrective actions. When people tend to make, when people make mistakes, usually those are corrective actions where we work with people and do training and supervision. But when it's something that's, the word for it, but not using their integrity and doing the wrong thing, we want to get them out. And we've been much more successful at doing that as we've brought more people in. We're getting good people in that place now.
Okay, great. Thank you.
Yeah.
One more question. I think this is for the administration. This came up in Budget and Finance yesterday, but I'd just like everybody in the room to hear this. What is our steps in regards to, let's say, there are incidents? What are the contractual obligations, and is there an out?
Thank you, Mr. Chair. I really don't want to speak for legal on this. I'm sorry. I don't feel comfortable answering that.
I believe the answer was that there was an out. I would just like that confirmed, though.
Council.
Apologies, could you repeat the question about an out?
Yeah, so let's just say there is a major incident, one that causes us to have concern in regards to the future of the management of our youth correction facilities. What is our actions? What can we do in regards to the contract that we're moving forward with?
The contract has the Metro's standard termination clause in there, but this contract also additionally has a list of liquidated damages, so that if it's a certain type of action or inaction taken by the contractor, Metro can provide notice to the contractor to cure that, and also, or in addition to, or in lieu of, collect liquidated damages in a certain amount. So in certain cases, and I can't list for you all the different types of liquidated damages, but in certain cases, it's $10,000 per damage. In other cases, it's I want to say $2,800 per day that the action or inaction continues. And I would guess that Judge Callaway could provide you with more detailed information on that front.
Thank you. Councilmember, do you need to?
I'd just like to say thank you, Ms. Darby. That was more of a detailed answer than we got yesterday.
Would you like Judge Callaway to share any additional information? Perfect. Thank you. Judge Callaway, would you like the floor, yes or no?
Oh, I'm sorry. Yes.
Go right ahead.
Briefly, I would not have any of the specifics listed out right now as well. But there are liquidated damages. I think we attempted to do a liquidated damages type of contract with YOA when we had them. We learned a lesson. We are in the process, I think, still of trying to recover from the losses that we had when we were working with YOA. We learned from that, and we learned that it had to be more specific, and we had learned that it had to have a certain time period. And so we changed the contract and the language in the contract to make sure that we would be able to recover if there were some breaches. And so I think we learned a lesson from the original contract that we had with YOI to make it stronger, to make it more solidified, so that they can make sure that they understood what their expectations were and what our expectations were and what would happen if they were to violate any of the conditions.
Thank you, Judge Callaway. Councilmember Huffman, any additional questions? Councilmember Benton.
Thank you, Chair. Judge Callaway, thank you. I know what you do is difficult. Our youth are precious, and we want to get them on the right track. And I appreciate what you do very much.
Thank
They're
you.
our future.
Yeah.
And I appreciate what you, Mr. Wood, do. And I get it, it's tough. And I don't think I would be suited for that. It's tough. My real question is, and I know you gave us the sentiment of Sheriff Hall, that he really didn't want to do it either. And understandable, it's complicated. I thought I heard that there was a study done to find out what it would take for us to manage. And I didn't know if that study was complete and we have those results and how they compared. Did I give you enough?
Okay.
Okay.
All right. I was making sure I waited to get called on this time.
Go right ahead.
Thank you. Yes, we are in the process now of doing the study. We actually have Ms. Bree Robinson, who is with us today. She is the owner of PTY Consulting. I messed it up yesterday. And she is the owner of PTY Consulting. She actually did the same study for the sheriff, and so she was procured to do it for us as well. She's been here for about 3 months, and it's a total 9-month study, so we have a couple of months to go. And so she will, at the end of the study, be able to tell us the difference in the cost and what it would look like if Metro were to pay for it, how we do food services, how we do laundry services, how we do education, all of the things that we have to provide for the youth. She would be able to do a side-by-side look at what it costs for a private facility to do it versus what it costs for us. And then if we decide to do it, she'll also be able to tell us how to transition and the best way to transition to doing it for ourselves.
Follow up on that.
Go right ahead.
So obviously, that's going to eat up a year, almost. And we want incentive for them to come in and invest in us too, Mr. Wood. Is this 3-year term, right? Is that correct?
Yes.
As written. Would a 2-year term incentivize Mr. Wood and his team to still fight hard for us? And really, I don't think it's about him fighting hard, it's about being able for him to get and recruit the good people. For us to get the results from our study, to kind of know where we're at, even if we wanted to consider it. I got a feeling we're probably not going to want to because of the complicated nature of it, but just on balance, question, 3 years versus 2 years, would we still get, a decent result and still be able to have that open consideration in case of whopping change of cost?
Yeah, I don't know if it would be more beneficial to do a 2 versus a 3. I do know that in the 3-year period, we would be ready to move into the Nashville Youth Campus for Empowerment. And so if there were a change, if there were a 3-year period, that would lead us right into opening up the new facility with the decision of whether it's with the private company or whether we're operating ourselves. And it may make a transition much easier if it were at that time period.
Thank you.
Thank you, Mr. Benton. Councilmember Ellis.
Thank you, and thank you for recognizing me, although I'm not in the committee. And thank you, Judge Calloway, and all of your employees for doing the Lord's work. We know that. So I know we're short on time, and I have a loaded question, but you being the brilliant legal mind that you are, I know that you can help me answer this on behalf of my constituents. So it raises alarm that for me, in reading this, that it's 131 employees with a juvenile clerk. And remember, I'm still new, okay? So there's 131 employees with the juvenile clerk's office or the juvenile clerk detention facility, or somewhere there's 130 employees. And so we are being asked to approve a $24 million contract with Rite of Passage, and they were flagged on a multiple of things in the audit alert for a high risk, and we're asked to correct some of those issues by the end of February. And so the thing that brought me concern is that I did not see an email or anything addressing some of those issues that the audit report flagged. And my instinct is to defer this for at least 90 days so that we can have time to go back and understand more about if, things have been corrected, if it's still at compliance. And the summer is coming up. And so the education and the, all the issues that goes along with kids being out during the summer, that's where my line of thought is. So help me, filter that and tell me why this is a good thing to pass, despite all that.
Thank you.
Yeah, Judge Calloway.
All right, thank you. And just of juvenile court and the way that it operates. So the juvenile court, the operation of the juvenile court, there are about 131 positions. That's to run the court side of services. That's for all of our magistrates, our probation officers, our warrant officers, our administrative assistants. And so that's for actually the work of juvenile court. That's for, we have about 3 different divisions that we do. We have a parentage division that does unmarried parents, custody issues, and we have a division that does neglect, independent, and abuse cases. And then we also have a division that does delinquency and status offenses for our youth. And so that's just like the courthouse. The juvenile court clerk, it's a lot. It's a lot. When I look at all the things that I do in a day, it's a lot. The juvenile court clerk is a separate entity that's run by Lionel Matthews, and they are the record keeper of the court. And he has about 30 employees. So separate from running the court facility and the court building, I'm also responsible for our youth who are held in a pretrial detention facility. And that is connected to our court. It is under my jurisdiction, sort of like, I guess if the criminal courts were under the jail, it would be under their jurisdiction, although that's kind of separate. But I do run our I am in charge of managing our juvenile detention facility. And so we, on average about 40 to 45 youth who are detained on a regular basis. And what I explained yesterday is our contract is built on a per diem rate for 48 youth. And so it is our incentive to make sure that we are keeping that number down and under that number so that we're not assessed a higher rate. As the operations of the detention, we have historically had a private facility that runs it, and that's been since about 1996. And so when I came into the position, we were already operating under a private facility running it. So there are definitely concerns, and I misspoke yesterday when I talked about it. The audit was from a period of July of 2021 to 2 years later. So the first year, it included the previous numbers from the previous contractor, YOA, and then from the rest of the period from our current contractor. When YOA left, there were a lot of difficulties and there were a lot of issues. It has definitely gotten better since YOA has gone, and we've been working with ROP. ROP will tell you today, as we have said, that we're not perfect yet, and they're not where I would love them to be. There are definitely not significant like it was in 2021, but there are some issues still with staffing. It is important for us to have a contract as soon as possible for that they can get that per diem rate higher, because the month to month is at a lower rate. If they were to have a higher per diem rate, then we could guarantee higher salaries for the people who work there. I think it's to me, I've gone across the country. Workers in juvenile detention facilities are few and far between. It's not the easiest job in the world, and you could probably make more money at McDonald's or Chick-fil-A and not have as much difficulties and challenges. And so it is not a job that people are knocking on our doors to do. And so we have to do a lot of recruiting. And one of the recruiting tools is salary. And if we can increase the salary as soon as possible, we have a better chance of having more qualified workers to come and to stay and to be committed to working with our youth. And so for me, that's why it's important for us to go forward today. We can talk about, Ms. Wade is here and can explain what our audit responses were and our plan for the audit and the things that we're doing. And ROP can also explain to you their response and what they're doing to make sure that they're making sure they're reporting all the incidences on time and the way that they're supposed to, as well as making sure that they have the staffing when need be.
Outstanding. Thank you. Councilman, we have one other question, follow-up? Yeah. Thank you.
Just a follow-up to help narrow it down. So my concerns was the educational piece, making sure there was more controls in place to make sure that it's accurate reporting and people aren't being informal. And the second thing was the making sure that the records are being kept accurate and that you're able to reconcile that with the MNPD.
So I will say, and I think Jennifer's biting at me to say something as well. The actual education piece is not the rite of passage piece. All detention facilities in Tennessee, the education is run by the LEA. And so Metro Nashville Public Schools is the entity that runs our education system within our detention facility. And they have contracted with Chance Light to actually run that portion. I have had, since the audit has come out, I have had good talks with Dr. Battle. Ms. Wade and our Latana Williams have met with their school services people, and she can tell you more about that meeting, about making sure that they're doing the education piece. So the education piece is actually not on rite of passage. It's Metro Schools has to run that, and they have contracted that out. They did re-up their contract with Chance Light, and Dr. Battle is well aware of the audit and the things that are in the audit that need to get better, and she is willing and ready to work with that. And I'll let, if it's okay, let Jennifer Ms. Wade add something.
So just to remind the committee, we are on our first item. We have a presentation, and we are at 4:06 for a committee meeting that will end at 4:30. So you can, yes, go ahead, Ms. Wade, after that. A reminder.
Thank you. Real quick, you also asked about incident reporting. We do meet daily regarding incidences in our detention facility. Our contract monitor, myself, we do engage with ROP on a daily basis via email and in person. We meet monthly, sometimes weekly, regarding incidences to make sure that things are being addressed and corrected. We've had several meetings after the audit findings to specifically talk about seclusion incidences, behavioral interventions, using positive behavioral interventions. And then you also asked about the MNPD reconciliation. That also is separate from our detention facility. That's a systems-wide issue where we have to reconcile a semi-antiquated arms systems is what it's called, with all arrests. But we, of course, there are juvenile arrests in Nashville. And so we have to do some reconciliation with the police department around that. That's less on ROP, more on both juvenile court and the police department to engage in conversations around how to make that more robust. And we are having those conversations as well.
Thank you. All right. Any other discussion on RS 2024-392? Thank you, Judge Callaway, Magistrate Wade. Thank you all. All right. RS 2024-392. It's been properly seconded in motion. Seeing no other discussion. All in favor? Any opposed? And any not voting? All right. The measure passes. Item number 3, this was deferred in Budget and Finance. Just to let you know, committee, RS 2024-397 by Porterfield, Evans, and Taylor accepts the terms of a cooperative purchasing master agreement for executive search and direct permanent placement services for the Metropolitan Action Committee. Do I have a motion? Is this to approve or to defer?
Can I make a motion to defer? Just go from there.
Outstanding. We do have a motion to defer. Thank you, Councilmember Huffman. It's been seconded by Councilmember Bradford. All in favor? Any opposed? Any not voting? Outstanding. Number 4, RS 2024-398 by Porterfield, Evans, Welsh, and others appropriates grant funds from the Tennessee Housing Development Agency to the Metropolitan Action Commission for Low-Income Housing Energy Assistance Program, services targeted toward the elderly, disabled, veterans, and households with young children. Have a motion? It's been moved and properly seconded. Any discussion? Seeing no discussion, all in favor? Any opposed? Any not voting? Motion carries. Number 5, RS 2024-410 by Porterfield, Evans, Welsh, and others accepts a presumptive eligibility service grant from the Tennessee Department of Health to the Metropolitan Board of Health to provide prenatal presumptive eligibility program enrollment assistance to pregnant women and presumptive eligibility program enrollment assistance to individuals diagnosed with breast and cervical cancer and precancerous conditions of those diseases. Any discussion? Oh, sorry, thank you so much. We've got a move in second. Any discussion? All right, all in favor? Any opposed? Any not voting? Motion carries. Number 6, RS 2024-4111 by Porterfield, Evans, Welsh, and others appropriates a total of $1,530,329 for the Metro Office of Homeless Services to various nonprofit organizations to build the capacity of Nashville, Davidson County Continuum of Care to address homelessness. It's been moved and seconded. Any discussion? All right, seeing none, all in favor? Any opposed? Any non-voting? Motion carries. Number 7, RS 2024-412 by Porterfield, Evans, Welsh, and others appropriates a total of $436,400 from the Metro Office of Homeless Services to Safe Haven Family Shelter for provision of hotel rooms across the Nashville area for emergency alternative shelter for families with minor children. Do we have a motion? It's been moved and properly second. Any discussion? Councilmember Huffman.
Thank you, Chair. My question, if we've got somebody here, is with Safe Haven, actually. Stay up there, Bill, though. I may need you. Nobody here. I'll ask you. So I read through the attachments for this, and it was very well put together in regards to the coverage. So you get essentially 80 families over a year. But can you confirm just for everybody that this funding is not recurring? This is a one-time thing, and this is something that Safe Haven will have to continually get?
Yeah, go ahead.
Thank you. Yes, that is correct.
And can you also talk to how the Office of Homeless Services is involved with Safe Haven regarding when a family is not successful in taking that next step, and let's say they end on the streets? The average time per Safe Haven is about, I think it's 90 days within their facilities.
Yes, sir.
Roughly. How does OHS interact with those families in those instances?
Well, Safe Haven will be supplying monthly reports on the families that are served so that we can keep track of them. If there is any fallout, of course, our outreach team, our CE team is going to become involved and then try to, maintain that relationship with the family, see if we can place them in a better situation.
And outreach workers already work with the individuals because they work directly with Safe Haven and getting everybody in coordinated entry, right?
Right. So they'll come through CE for this. And this is kind of a response to the lack of family shelter that is available, trying to make that available.
That's what I was getting at. Thank you, sir.
You're welcome.
That's it.
Thank you, Mr. Huffman. Thank you. Any additional discussion? Seeing none, do we have a motion? Second. All right. Motion's been properly moved and seconded. All in favor? Any opposed? Any non-voting? All right, motion carries. Item number 8, RS 2024-413 approves an agreement between Middle Tennessee State University and the Nashville Fire Department to provide qualifying employees with affordable access to degrees offered by MTSU. And do we have a motion? All right. And we do have discussion. Councilmember Prepti.
Thank you, Mr. Vice Chair. Actually, this is more of a parliamentary inquiry to see if we can take a superseding motion to consider the following under consent: RS 2024-413, 414, 415, 416, and 417.
I have no problem. Committee members, anyone see a problem with that? Outstanding.
So moved.
Thank you. All right, so RS 2024-413 has been read. 2024-414 accepts an in-kind grant from the State Farm to the Metropolitan Nashville Fire Department to receive 2 scholarships to attend the State Farm Arson Dog Program, including all training fees, acquisition of the dogs, and certification of the K-9 team. RS 2024-415, Porterfield Evans Taylors approves a sole source contract between the Metropolitan Government and Benchmark Solutions, LLC, DBA Benchmark Analytics, LLC, to provide the benchmark management system, among other things, for the Metropolitan Nashville Police Department. RS 2024-416 approves the First Amendment to an agreement between the Metropolitan Government of Bold Cellmark Forensics Incorporated, DBA Bold Technology, to provide testing forensic biological evidence. And RS 2024-417 approves Amendment 1 to Community-Based Traffic Safety Enforcement and Education Grant from the Tennessee Highway Safety Office to the Metropolitan Nashville Department to continue the enhanced DUI enforcement initiative and targeted distracted driving and seatbelt enforcement. All right, that's been moved and properly seconded. Any additional discussion for those? No, seeing none. No. We do have discussion. Council Member Kimbrough. So would you like to pull, which one do you like to pull from consent?
I just had a question regarding, regarding,
Are we looking at item 414, number 9?
I'm sorry, it's on the wrong page. Not 414. I had a question regarding, I believe it is 415 and 416.
Okay, so we will remove those from consent and we can vote on the additional items. So that will be items 412, 413, 414, and 417, and items 415 and 416 have been removed from the consent. So voting only on the consent agenda. All in favor? Any opposed? Any non-voting? All right, those items move back to RS 2024-415. Approves a sole source contract between the Metropolitan Government and Benchmark Solutions, LLC, DBA Benchmark Analytics, LLC, to provide the benchmark management system, among other things, for Metro Nashville Police Department. We have discussion. Councilmember Kimbrough.
Yes, thank you, Chair. I just had a question. I wanted to know what benchmark analytics were and what that contract is about.
I would like to, do we have, okay. Yes, we have someone here. Thank you.
Captain Kelly Cantrell, Metro Nashville Police. The software is used, it's our early intervention system, so it analyzes data sets to determine if there are actions taken by officers that may be precursors to potential bad behavior in the future, or acts that may not be in line with our goals as a department or our policies. And so it gives us the opportunity to address potential issues before they become a problem.
Councilmember Kimbrough, we have follow-up.
Okay, no, not on this one. That's my only question on that one.
That's your only question?
Yeah, okay,
So
that's it.
we still have to
Sorry.
vote on this one. All right. Councilmember Prepteet, can you give us a motion as well, Councilmember Prepteet?
Yes, thank you, Mr. Vice Chair. I move that we undertake consideration of item number 10, RS 2024-415.
For approval, thank you.
Yes.
All right. Councilmember Prepteet, for discussion.
Yes, thank you. And thank you, Captain Cantrell. Could you talk a little more just about sort of like how this system operates? And it might be a super technical question that you're not able to answer, which is more than all right, kind of put you on the spot here. But I'm just curious to know how exactly the software operate? Like, does it review body camera footage? Does it review like the going into like narratives that officers share within arrest and search warrants? Like, sort of like how does this software operate?
The information that I was provided is that the benchmark model relies on daily updates and constant monitoring of hundreds of data points for each individual, learning from the micro patterns to apply to a macro population. So it assesses a multitude of things, and my understanding of it doesn't go much beyond that as far as the technical on what it's looking at, but I know from my personal experience on receiving, potential, hey, you may want to follow up with this person to ensure everything is going okay. It was in relation to arrests that person had made that fit a particular data set to ensure that those arrests were not done as opposed to anything other than application of the law under the circumstances that the call response was related to.
And so with this program, essentially, part of what I'm hearing is that we could potentially be able to identify any officers who are conducting themselves in a pretextual manner that could potentially be racially motivated or patterns of use of excessive force and things like that.
Yes, that's correct. The hope is that what this program helps us do is identify that possibility early on to address it before it happens.
Thank you.
Thank you. Any additional discussion? Seeing none, we have a motion that's been properly seconded. All in favor? Any opposed? Any not voting? All right. Thank you. On to item number 11, RS 2024-416 by Porterfield Evans Taylor approves the First Amendment to an agreement between the Metropolitan Government and Bode Cellmark Forensics Incorporated, DBA Bode Technology, to provide testing of forensic biological evidence. Council, can I have a motion, please? All right, thank you. So we have a motion moved and properly seconded. Councilmember Kimbrough.
Yes, thank you. I had a question about, is this the one we had last night? Okay, for some reason I thought it had the amount on there. So this is the one where basically Metro will increase its, I guess, budget regarding these type of analysis really by 400%. Is that right?
Go ahead.
Okay, thank you.
Captain.
So it's going to increase their ability to use that contractor to a larger dollar amount. So it doesn't actually impact, my understanding is that what their actual budget is, but it allows them to utilize that vendor for a larger amount.
Okay, so are you saying the money's already there and this, what do you mean just to increase? I'm not understanding.
I guess my understanding is that it allows this contract to increase to $1 million as opposed to $250,000 using the vendor.
It's increasing pretty much by 400%, right?
If your math's correct on that. I haven't done the percentage.
We're from
Forgive me.
$250 to $1,750,000. And I wasn't clear last night. That's why I'm trying to ask now. This vendor will do more testing? Is that what you're saying?
So when we gather the DNA evidence for processing, it would allow the crime lab to send more of that evidence to the vendor as opposed to processing it in-house, which has been taking longer. So by utilizing the vendor for more, it should hopefully decrease the backlog of in-house processing while also processing that evidence faster, so that hopefully will increase our ability for prosecution at a faster rate and reduce recidivism and hopefully prevent future victims by taking those criminals off the street sooner based off of that evidence coming back sooner.
Okay, but have you used this vendor before?
Yes, ma'am. They're currently using them, just to a smaller
vendor.
degree.
Okay, and but Metro will continue to test as well, is that right?
Yes, it'll give us the ability to test cases in-house and cases out. So they wouldn't be double testing the same evidence, but they would be able to send cases, more evidence out for processing by the vendor.
Okay, this is my request, just because I have a lot of questions I would like to ask you, and it might really be a good idea, what you're saying. It just causes me pause because we're kind of to be the gatekeepers of the money and everything, and this is such a dramatic increase, you know. It's not saying we're gonna increase it by 10, 20%. This is really an increase by 400%. We're going from 250 to 1 million, and it's still somewhat unclear. I just have a few questions I'd like to ask. I would like to move to defer this for one meeting, just so I can ask my questions. And she may be 100% correct and answer everything to the T. So that's my request, Chair.
There's been a motion. We have a second. All right, perfect. There's been a motion on the floor to defer this item by one meeting. There's been a second. Do we have discussion? All right, outstanding. So Councilmember Huffman and then Councilmember Nash will be next. Councilmember Weiner after you.
Thank you, Chair. Just a quick clarification in regards to the operations of this committee. Anytime that I have a detailed set of questions prior to a meeting, I always, in this instance, I would ask Chief Gilder and we'd go back and forth. And I would just like to encourage my colleagues to utilize that as well. It's always very helpful to get all your questions answered, and then you can do follow-ups.
Thank you. Councilmember Nash.
Thank you, Vice Chair. I would like to speak against the deferral. Ever since I was at the police department, there's always been this backlog of DNA evidence and at that time, we were using only the state. Shortly after I retired, we had opened up our own lab, but the level and the amount of DNA evidence and whatnot has just multiplied over 400%. And this, I think it's important, if we just look at recently what happened in Memphis, the jogger that was attacked, raped, killed. The person who committed that crime would have been already under arrest for a previous rape if the DNA had been able to be tested quicker. And so that's kind of where we're at. We should be doing all we can to determine the DNA evidence as fast as we can. And this is part of that process, and I think we need to go forward.
Thank you. Councilmember Weiner, and then we'll go to Councilmember Prepti. Councilmember Weiner.
Thank you, Chair. I appreciate it, Vice Chair. So I have to agree with Mr. Nash and was actually going to use the same example of the case in Memphis. That's a family friend that was murdered. And he's right. Had that DNA been tested sooner, she may still be walking the streets with her children today. As far as a deferral, we hear in the news, and I hear from officers all the time, we need some methodology to get this DNA checked sooner rather than later, and the backlog is growing. It's exponentially growing. And if we sit here and defer, then what we're doing is we're kicking the can down the road, and there are women who have been victims of rape. There have been children who have been victimized, and they're continuing to wait while their aggressor is walking the street. And so for those reasons, I have to oppose the deferral. Thank you.
Councilmember Prepti.
Thank you, Mr. Vice Chair. I rise in favor of this deferral, and I understand the viewpoints of my honorable colleagues, which are valid points. Having worked in the criminal legal system and understanding that the analytics of biological data and evidence isn't just for proving cases, but can also be used to show that it could be exculpatory evidence. But I think that we play such a vital role on council and in this body to make sure that we are doing our due diligence, that we're being good stewards of our resources, and making sure not only that our departments have the resources that they need, but that we're actually being diligent in the way that we allocate those resources. So our colleagues have very real questions that they want answered from our various departments, and I would just ask to see if the administration or if Captain Contrell, if you have any opinion on whether or not a one meeting deferral for just our next meeting in 2 weeks would substantially hinder the purpose of this contract.
Thank you. I'm sorry.
No, it's quite all right. I was asking opposing questions to either the administration or to Captain Contrell if a one meeting deferral would frustrate the purpose of seeking this contract here today.
Captain Cantrell.
I'm unaware of any timelines as far as what the crime lab is dealing with, but we have cases that are producing DNA evidence every day. So every day that the contract is limited to the extent that it is one more day that we add to the backlog.
Any further questions?
That's all, Mr. Vice Chair. I would just reiterate that I speak in favor of the deferral.
Thank you. Councilmember Kimbrough, Councilmember Huffman, did you have something? Did you want to be added to the list as well? All right, Councilmember Kimbrough.
Thank you. I just wanted to make clear, I'm not saying that we don't have crime and that evidence should not be processed. And I just wanted to look at the numbers. What they're saying could be extremely logical, okay? I just want to look at the numbers because we are asking for so much, such an increase. That's the only reason I want to look at it. Because if we just say, okay, evidence needs to be processed, what's the difference in increasing it 750 as opposed to 7 million? I mean, I just want to make sure we kind of making sure it kind of makes sense, and it very well may. It may turn out they might need even more than that. But I'm just asking for this one meeting deferral to look at that. And I appreciate what you said, Councilman, and I will take heed to that. Thank you.
All right, any other discussion? All right. Seeing none, we're voting on a deferral of item number 11, RS 2024-416. All in favor? We're voting on the deferral. So we're voting on the deferral. So we'll back up and just kind of go through this. So we had a motion for approval that was seconded. We had discussion within the discussion. We had a deferral motion that came within the discussion, and now we've had discussion on the deferral motion, and now we are at the vote for the deferral motion. What we're going to do is just do a hand raise here. For the deferral motion. So all in favor, please raise your hands. All right. All against the deferral motion, please raise your hands. Any non-voting? All right. So deferral fails. So now we're back on the motion to approve. RS 2024-416. No discussion, so, any further discussion, I guess, so no further discussion. All in favor of RS 2024-416 for passage, please raise your hands. All right, thank you. And all against RS 2024-416, please raise your hands. Any non-voting? All right. So the motion carries for approval, and that is the end of our calendar. So we have a guest here. So Ms. Brookhos, Mr. Mike Randolph, Mr. Fred Smith are going to share with us in regards to the REACH program. With the Mental Co-op and the National Fire Department. And so if I could ask you all just to come to the podium here up front. Thank you. All right. So, Ms. Haas, Mr. Randolph, your microphones are on. The floor is yours.
Good afternoon. Thank you for having us today. My name is Michael Randolph. I'm the Director of Co-Response Services at Mental Health Cooperative. Here to talk to you about our REACH program. REACH is Responders Engaged and Committed to Helping. It is a pilot program and a partnership between the Mental Health Cooperative, the Nashville Fire Department, the Metro Health Department, and the Department of Emergency Communications. It partners a master's level clinician with paramedics to answer nonviolent mental health calls with the goal of providing immediate and appropriate care for individuals having a mental health crisis, to reduce unnecessary ER visits, streamline care for families and individuals in a mental health crisis, and safety for individuals, families, clinicians, and paramedics in this program. And we really follow a no wrong door approach for getting our Nashvillians help.
Good evening. My name is Brooke Haas. I'm Commander of EMS Operations for the NFD. Another one of our goals that was extremely important to us and to the community was that we attempt to reduce the number of ambulances that were involved in responding to the mental health crises, mental health emergencies. The way that we are still responding to some calls and were responding prior to this pilot is that any 911 call that involved a potential mental health or behavioral health emergency would result in an ambulance responding as well as a first responder piece of fire equipment responding as well. And so there was a need within our community to find a better, like Michael said, a more streamlined approach to getting these individuals more appropriate care, but also allowing our ambulances to remain in service so that they would be available for medical emergencies within the community. As Michael said, we partner an NFD captain level paramedic with a mental health co-op clinician. And the teams are operating currently out of 2 SUVs. We have 2 teams, so it's 4 people total. And they are operating from Tuesday through Friday from 10 a.m. until 8 p.m. Everything that we developed was data-driven. And the data that we had been collecting for several years prior with the help of the health department, epidemiologists there, showed that those were the primary times that we needed to have coverage. They are responding, like Michael said, to the nonviolent psychiatric emergencies. We still do have quite a number of emergencies that come in through 911 that potentially involve violence or weapons. And with those, due to safety, we still respond with law enforcement, with an ambulance, with an EMS supervisor, and with a piece of fire equipment. Like we said, everything that REACH does is data-driven. We're capturing everything internally within our own departments, but we also work very closely with the health department epidemiologists who give us quarterly data that is shared through the BWAC committee. And we're really happy to say that the pilot started in February of 23. And as of yesterday, the 2 REACH vehicles, which are not backfilled currently, that was part of the pilot when somebody is on vacation, the 2 REACH vehicles have responded to 826 calls for service since the inception of the pilot. In total, that is 615 times that an ambulance has been left available to serve the public for medical emergencies. 74% of the total calls that REACH has responded to have saved an ambulance and left it available for medical emergencies. REACH has provided medical and mental health evaluations for a total of 762 individuals. And we have done, I think, a good job of adapting as we have gone along, as we've seen needs that have arisen. We've refined dispatch, well, through working with dispatch, we've refined the way that we are dispatched. We've refined the types of calls that we are going on with the patient safety and our safety at the first and foremost with that. And Michael has some more specific data that he'd like to give.
Yeah, the results of our pilot have been very encouraging. About 22% of all mental health crises were able to be resolved at a person's home or at the community where we meet them. About 25% go directly to the Mental Health Cooperative's Crisis Treatment Center to begin getting help there. 11% were able to go straight to an inpatient psychiatric facility and avoiding an ambulance ride, an ER visit to get that kind of care. 70% of the people were actively suicidal. 29% were experiencing some sort of psychosis, so they were having some sort of delusional thoughts or hearing some sort of hallucinations or seeing things. And credit to our dispatchers and our partners there, only 5% of the calls that we were dispatched on had some sort of homicidal ideation available. We had 2 arrests over the time of the program. The housing status was 27% of the consumers that we served were unhoused. 50% were rent or own their home, and then 20% lived in a group home or transitional housing. We're really encouraged that we were able to help people meet them where they're at quickly and walk through them with them in their crisis to getting them help quickly and effectively and saving the city resources and keeping people out of emergency rooms and getting people help quicker.
So looking ahead to the future, the pilot ends on June 30th of this year. And our hope, our goal is to double the response that we have. If we are able to double it, I think that will, obviously we will see improvements and increases in the number of people that we're helping. But I think that is a reasonable goal as far as staffing and finding paramedics and mental health clinicians. If we do a slow expansion in that way, and that is our hope. We would like to, in the future, be able to provide more direct oversight. If the program is to expand, we want to make sure that we have direct oversight of the program for the sake of both the patients, the individuals we're serving, and our personnel. And we also think it's vitally important that we maintain the ability to provide quality assurance and quality improvement as we grow the program. Any questions?
Any questions? Yeah.
Thank y'all. First off, the pilot has been an amazing success. I preach consistently almost every day about the need for increased mental health funding and services within not only our city but our state. So you said 762 individuals received treatment, is that correct?
Yes, sir.
My question is, of those 762 individuals, do we know who had received treatment prior in some sort of mental health capacity? And a follow-up to that, if they had, was it an issue with just a lack of consistent medication being taken?
Yeah, great question. The recidivism data is very important when it comes to REACH and our Partners in Care program, which I also oversee. We're able to kind of cross-reference which people are being seen repeatedly in both programs. And part of our expansion efforts is to get a follow-up coordinator. Right now, 8 individuals have been identified who repeatedly use both programs, and really being able to hone in on what kind of needs and wraparound services those individuals need to kind of reduce interactions with first responders and emergency rooms. We started a follow-up coordinator in January for Partners in Care, and that's part of our expansion request for REACH as well, to really make sure when people leave that time of crisis that they're surrounded with the tools they can have for success and not being in the crisis system and not having to call 911 for help again. But right now the recidivism is pretty low, kind of on par with our Partners in Care program, where about 70 to 80% have never been seen and don't get repeated visits.
Thank you. Councilmember Nash.
Thank you, Mr. Vice Chair. I heard the word something direct oversight, and I was curious about what that meant. I would think you have direct oversight currently. What would be changing?
Yes, sir. We do have direct oversight currently, and we are doing that concurrently with the other responsibilities that we have overseeing the entire EMS operations of the fire department. We think it's important as REACH expands, and hopefully it will, that we will be able to have an individual whose job it is to be available for them during their hours of service. that won't be in a meeting and unable to respond, won't be in a meeting, unable to answer questions. There's been many, many, many times where we've had our paramedics or clinicians need to run something by one of us. They have a question, they're unsure. As this develops, that gets less and less. But we would like to be able to have somebody who would be there for them to oversee at any time. Yeah, go ahead.
Yeah, I can speak that a little bit more. On the mental health side, there's on-call supervisors and supervisors who just oversee the clinicians. And I believe my esteemed colleague here is wanting a supervisor on the fire department side to oversee the program and ensure quality delivery of services.
Understand. Councilman Nash, you have a follow-up?
No, thank you.
Any other questions? When we think about, I have a question. When we talk about doubling, what fiscal note does that bring? Financially, how much does that cost for you all? How can you outfit it?
I'm Deputy Director Fred Smith, EMS. So that's a good question. We're probably looking at closer to 750, 800,000 for the entire expansion of the program. So what that's going to do is give you that oversight, district chief. As this program expands, I'm certain it will. The work that's being done now is just a fraction of what's possible out there for this community of folks that really need the help. And if we're able to double the program now, I'm certain we're going to come back to your table again and again in the future years. But having that oversight already in place that can manage the quality improvement, reading their run tickets, assuring that everything's being done appropriately, and then being able to give that feedback in real time to the crews on the street is where it's most effective and most beneficial. So,
Thank you.
To answer the question.
No, absolutely. And how far of a reach would this put to incrementally increase now? How much of the county would we be able to serve?
So right now, the pilot is countywide right now, but we would like to expand our hours and days to Monday through Saturday, 12 hours a day.
Outstanding. Thank you so much. Councilmember Nash, I see you have a question.
Thank you, Chair. You kind of were headed in that direction. Have you got a budget request in for this year, and is it in the current mayor's budget?
Yes, sir.
All right, thank you.
Thank you, Councilmember Nash. Any additional questions? Yeah, Mr. Young. Yeah, go right ahead, Mr. Young.
Councilman Nash, I think to your question, and Brooke and Fred, you might correct me, it's in the fire department's request, but it's not actually in the mayor's budget. You will see it in your wish list, I guess. The fire department has a priority list that I think everybody will see during y'all's budget discussions. And this is number 3 on their wish list item.
I believe you're correct.
Is that correct?
I believe that's accurate. Yes.
Yeah.
It's in our budget request.
Yeah. So we're hoping that you council members see the need in what was presented and believe in the program.
Thank you. And Councilmember Nash, they clear up your outstanding. Any additional questions? Okay, thank you so much, you all, for joining us today for the REACH program. The meeting now is adjourned.